How do bladder sling procedures treat stress urinary incontinence, SUI? Imagine a tiny hammock gently supporting your urinary system to help keep urine where it belongs. That's essentially what bladder sling procedures do for stress urinary incontinence. When you cough, laugh, or exercise, pressure increases inside your abdomen, which can cause urine to leak if the support structures are weak. Sling procedures help by providing that support, restoring normal function and reducing leaks. The surgery involves placing a supportive strap or sling beneath the urethra and bladder neck. This sling can be made from synthetic mesh or, in some cases, from your own tissue taken from the lower abdomen or thigh. The goal is to lift and support these structures so they resist pressure and stay closed when needed. The sling acts like a hammock, helping the urethra close tightly during activities that normally cause leakage. There are two main types of sling procedures. The most common is the midurethral sling, which uses a narrow synthetic mesh strip placed under the middle part of the urethra. It lifts and supports the urethra, making it easier for it to stay closed. The other type is the traditional sling, which uses tissue from your own body. This sling is threaded behind the pubic bone and under the urethra, then secured through an incision in the abdomen. It provides a more extensive support structure, which can be helpful in certain cases. The surgery is usually done under general or spinal anesthesia. A small incision is made inside the vagina, and another in the lower abdomen or groin. A catheter is placed temporarily to drain urine while you recover. The procedure typically takes about an hour, and most patients can go home the same day. From a bladder health perspective, sling procedures aim to restore normal urinary control without interfering with bladder function. They reinforce the urethral closure mechanism, helping prevent involuntary leaks during activities that increase pressure. While some patients might experience temporary urgency or discomfort, most see significant improvement or complete relief from stress incontinence. It's important to remember that these procedures are generally safe and effective, with high long-term success rates. However, as with any surgery, there are potential risks like urinary retention or discomfort that need to be managed carefully. For patients with a history of bladder cancer, doctors will evaluate whether a sling procedure is appropriate, ensuring it doesn't interfere with ongoing cancer surveillance or treatment. In summary, bladder sling procedures treat stress urinary incontinence by mechanically supporting the urethra and bladder neck. Whether using synthetic mesh or tissue from your own body, the goal is to create a supportive hammock that prevents urine leakage during activities that put pressure on the bladder. Always consult a healthcare professional to determine the best approach for your individual needs and health history.